Hi, ladies and gentlemen. It's Wesley of Wesley's Beats Radio, here with another exclusive interview, this time with Tasha Cunningham. Hi, Tasha. How are you?
Hi, Charles. I'm fine. How are you?
I'm doing great. I'm doing great. Thank you for being on, giving me some of your time to talk to me today. Can
Mhm.
you start off by telling again your name, where you're from, and the type of business you have?
Sure. So I'm Tasha Cunningham. I am a licensed massage therapist, occupational therapy assistant, and certified manual lymphatic drainage therapist. The name of my business is Life Wellness Studio Integrative Health Practice. And what I strive to do here is basically bridge the gap between mainstream medicine, such as physical therapy, regular doctors, and what's considered contemporary medicine, things such as massage, aromatherapy, and even chiropractors. What allows me to do the integrative part is I do have open-ended relationship with those who are licensed to provide counseling services through psychotherapy, but I myself am strictly limited to the massage therapy practices here.
Okay, awesome, awesome. So, how long have you had your business?
I got everything up and running last spring, so I've been in operation officially for a bit over a year.
Okay, do you have clients just come to you, or do you go out and see clients in their own environment?
I offer both services. I'm licensed in Maryland and in Virginia. I spend my time on both sides of the Bay Bridge. I cross it twice a week. So physically, people can come here. I'm actually sitting in the clinic. I can show you a little bit of that if that's okay.
Okay,
So people can come here for their service right here in Salisbury, Maryland, which is where I'm located. Even locally from where I am, I can be mobile for outcall services and also for residents of Virginia. When I'm across the Bay Bridge, I do work in Virginia still with occupational therapy. So I'm able to see patients in both Maryland and Virginia on that side of the bridge. Here, because of the driving distance, I'm limited to, I think I go up to 25 miles radiuses officially where I cover. So that takes me down to the state line roughly. I can cover as far down as Pocomoke area for people who need me to come out to them. But I do offer both mobile and on-site service.
okay, awesome, awesome. So, what is it that got you interested in doing this type of work?
Oh, well, I was doing the rat race thing, working strictly in occupational therapy for years. I have over 11 years experience in the field doing rehabilitation locally. I've done skilled nursing, I've done home health. A number of people watching this may recognize me. I did home health for several years here,
Okay,
working with people with stroke, all types of brain injuries, spinal cord injuries, things such as that. What I found was those people from a standpoint within the companies that they were being serviced by, I wasn't able to work with them in a global approach to their health. It was
right,
strictly make sure that their balance was good, that they could walk, they could feed themselves, that they could dress themselves again. But treating just one part of what's going on is not what I wanted to do. I was doing too much time away from my children as well. And
okay,
I decided that with my education and furthering my credentials, I would be able to offer something that would treat people not just as a name and a number, but address all aspects of who they are for their well being, both mentally, emotionally, and physically.
right. Okay, so what do you see the most of? What is the what people have? What is the majority of what they have going on that you're actually treating?
Well, I see patients, or rather, I see clients in this setting. I see clients who come to me because they need stretching. I've had people who are triathletes doing competition and doing training for weightlifting competitions, things such as that, that they have to participate in. I have those who want a strict wellness relaxation massage. I'm not a spa setting. However, I do incorporate just regular old Swedish or wellness massage into my business here. And then I have those who need lymphatic drainage. Now, I can't treat everyone based on what their condition is, but I do offer the manual lymphatic drainage. People who may have had stroke or some of my recent patients are going surgery, whether elective for cosmetic surgery, such as BBLs or implants elsewhere. along with those who have had amputations and they need to control edema, those who have had removal of breast tissue from cancer and they develop edema in a limb. So I'm able to operate my business from a perspective of you can come for relaxation, for the massage there. You can come because you may have a sports injury and you want me to work on getting your stretch and flexibility back into place. You may have edema from a surgery, or before surgery, you want to make sure that you're flushing your body of those toxins through your lymph
Okay.
system. I will address everything that I can in my scope of practice. And if it's something that I can't do, then I offer a referral elsewhere.
Okay. So do the patients that you or clients that you see, do they consult their physician first, or do they come to you, or is it just a balance between the two?
It would be a balance of the two. I will make it known I am not a medical practice, so I do not prescribe medications. I do not make diagnoses of things. If you have a condition that you've already been diagnosed with, I can accept a medical referral or you can come in on your own. I do offer consultation, so I can come out to you for a consultation if necessary, as long as within my area.
Right.
And also, you can come to me where I'm located here in Salisbury, Maryland, and I could work up a personal treatment plan based on what I find in that space of doing your evaluation. But again, not being a medical practice, I'm not making any diagnosis of a condition. Even though I may have an idea of what it is, you are not going to hear me say, oh, this is it. I'm going to give you a referral to a licensed medical care provider so can stay legally within my scope of practice.
Okay. Okay. And I was just wondering about that because sometimes people um they think they know what they have and they would I think would come to you, or they would ask their doctor, ask their physician, and
Mhm.
then it would kind of put you two, they would kind of play you two against one another. So you're not connected with the doctors whatsoever.
I'm not connected with the doctor as far as sending them people to one particular place. I can let
Right.
them know what resources are available in the community, but doctors, by all means, are allowed to refer people to me.
To
There
you.
are patients that are being prescribed regular massage therapy services for chronic pain,
Okay.
sports injury, edema. Those are things that I can see here in the studio, and I can take them either through the referral of a doctor, or if you think that's something you've been bothered with on your own, you're more than welcome to come see me. And again, if it's something I can address, then I will make sure you know. I believe in transparency.
That's awesome. Okay, before we end this interview, is there anything that you would want people to know that I didn't already ask?
I want people to know that they have to approach their health not just from a bottle, based on some prescription of a doctor that you see here once in a while and then have to deal with the side effects. I do not believe in approaching health from treating a symptom. I like getting to what we call the etiology. What is actually at the root problem? Again, I
Right,
cannot diagnose anything, but if you come to me with a condition, then I know how to treat that based on my scope of practice for massage therapy. I also do lean on my education. Again, I've been in occupational therapy, licensed in Maryland and Virginia as well. I've done that for a little over 11 years. So, working in rehab, working in skilled nursing facilities, working in rehab hospital facilities, doing home health services in that field has exposed me to a lot of education as far as what is and is not working for the patient in
right.
that setting.
Hmm.
Currently, I still maintain that education because I work pediatric occupational therapy services now for special needs children, and I also still do adults as on an on-call basis per se if they come into the office maybe for a workers' comp injury. So I'm still staying abreast of my education for both fields,
Okay,
and I want people to really take away that if you're coming to see me about something, I'm not just going to look at this little piece of paper that the doctor says, oh, you have a broken wrist or you have a strain in your shoulder.
mm,
Sometimes we have other things going on that we can't see. I have children, one of them has an autoimmune disease. And so things that she has to deal with, people can't see.
Right.
And what helps drive me is making sure that I can be present for my family, present in the community as a resource. They can come to me as a resource. I will give them the information that I can, treat them as well as I can. And if it's something, again, that I'm not able to help them with, I will definitely let them know. But my biggest takeaway is do not rely on just a simple prescription, a bottle and a pill. Be your own advocate and get to the root of what's going on and be
Right.
open-minded about the approaches you can take to empower yourself for better health, especially on that mental, spiritual, emotional space, not just physical.
Okay. Okay. That sounds pretty interesting. I mean, it's really, really interesting what you do and how you can help people. So can you
Yes. I also, oh, go ahead.
no, can you give me where people can reach you?
They can reach me directly online
Okay.
at lifewellnessstudio.com. So it's life-wellness-studio.com. The
Okay.
number here is 443-877-9361. Again, I am located in Salisbury, Maryland. If people go through the website, they will see a number of things there. I do wellness retreats. We wrapped one up just a few weeks ago out at Assateague Island. I
Okay.
keep a wellness blog, so to speak. Sometimes it's just little tidbits about what's going on in my life, words of encouragement, how to manage with stress. I do offer workshops for local businesses and schools. So if they have to get
Okay.
their employees together for workshops, I have stress management workshop, I have nutrition and fitness workshop, and even for the average Jane and John Doe of
Uh-huh.
America, I also offer a couples workshop. So it's
Oh,
an
cool.
opportunity to teach others within my scope of practice how to use touch through massage just to help deepen their connection within a relationship. So it's not just a in and out space. I try to approach things again from that global perspective. My workshops from nutrition and fitness, stress management, the couples workshop. I have chair massage as needed. People can book me if they need to for a bridal party, depending on how far away their event is,
Okay.
or a bachelor party,
Right.
considering on what it is. But
Uh-huh.
yes, they can definitely find me lifewellnessstudio.com. And again, it's life-wellness-studio.com. And again, that number is 443-877-9361.
Right. Thank you. Thank you so much for spending time with me, sharing
Mm-hmm.
your business and the knowledge with the world. I do appreciate you taking your time to spend that with me. Again,
Likewise.
this is Tasha Cunningham.